Hi everyone, this is Dr. Fox. Let's discuss the thyroid and parathyroid glands. In this video, we'll discuss the major endocrine glands of the neck, the thyroid and parathyroid gland, with an emphasis on their growth structure, relational positions, and blood supplies. So let's start with the thyroid gland. The thyroid gland is an endocrine gland that is variably located somewhere around the 5th cervical vertebra down to the 1st thoracic vertebra. So in lab, if you're looking for this gland, it may be quite low. So don't be discouraged if you're not seeing it right away. The thyroid gland consists of two cortical lobes, which are located laterally, which are connected by a central isthmus. Sometimes you'll see an accessory or pyramidal lobe present that connects the isthmus to the hyoid bone. This is quite variable, but it is present in about 50% of the population. Now, the thyroid gland is an endocrine gland, meaning that it secretes its hormones into the bloodstream. The hormones that it produces are thyroid hormone, so T3 and T4. These increase cellular metabolism and growth, as well as calcitonin. Calcitonin is going to decrease concentrations of blood calcium by enhancing osteoblast activity. The thyroid gland may be susceptible to hyperthyroidism, so an overactive, or hypothyroidism, or an underactive thyroid. Abnormal enlargement, you may have heard of previously, is known as goiter and may have several etiologies, but this is one of the reasons why we iodinate or add iodine to salt, so as to prevent goiter. Any of these conditions may have an effect upon hormone production, either over-secretion or under-secretion of these hormones. So here we can see on this illustration a typical sized thyroid gland, quite high up by the 5th cervical vertebrae. And here we can see an enlargement of the thyroid, or goiter, as it's commonly known. It's oftentimes large enough to be seen with the naked eye or upon gross inspection. Now, the blood supply to the thyroid gland comes typically from two positions. There are the superior thyroid arteries. The superior thyroid arteries are the first branch off of the external carotid artery, and they reach the cortical lobes from above. And then there are the inferior thyroid arteries. The inferior thyroid arteries come from the thyrocervical trunk, which are branches of the first part of the subclavian artery, and these are going to serve the cortical lobes from below. These inferior thyroid arteries have very close relationships with the recurrent laryngeal nerves, as we'll see following this, such that one needs to be careful when performing a thyroidectomy. So when one ligates the inferior thyroid artery, they need to be very careful to preserve the recurrent laryngeal nerve, lest an individual will lose function to their ipsilateral larynx. Also, in about 10% of the population, there is a vessel known as the thyroid ima artery, which is typically a branch of the brachiocephalic trunk, which serves the isthmus from inferiorly. And the thyroid ima artery can be a risk during tracheostomy. So if one is trying to get access to the respiratory tract through the trachea, that thyroid ima artery can be problematic for that. Next, let's turn our focus to the parathyroid glands. The parathyroid glands are several, and they're located in the posterior aspect of the cortical lobes of the thyroid gland. Typically, there are about 4 of them, but there may be more or fewer. Parathyroid glands produce parathyroid hormone, which is an essential hormone that increases concentrations of blood calcium by enhancing osteoclast activity. These parathyroid glands are principally supplied by the inferior thyroid arteries. Now, these inferior thyroid arteries, as I've discussed previously, have very close associations with the recurrent laryngeal nerves. The inferior or recurrent laryngeal nerves are going to serve the larynx. They are the major efferent or motor innervation to the intrinsic muscles of the larynx, and sensory and secretomotor to the mucosa of the larynx, inferior or distal to the vocal folds. So during a thyroidectomy, one should be very, very careful when ligating those inferior thyroid arteries so as to preserve the recurrent laryngeal nerves. So we've discussed the major endocrine glands of the neck, the thyroid and parathyroid glands. This is your summary slide. Thank you for your time.